Good morning, friends. In continuation of my case narratives, today I am going to present you a case of an young boy aged about 16 years suffering from the gastric ulcer. He is actually admitted into the Yelloor General Hospital, and barium meal X-rays were taken, and a small ulcer is found in the stomach, and he used to suffer with the pain a lot and all that, and the surgery was posted for the another 2 weeks or so, and the patient is not willing to have the surgery, and he made a lot of nuisance there, and he was discharged from the hospital. And the father, who is having a good belief in homeopathy, he is brought him to me with this complaint of severe abdominal pain in the gastric region, and with a couple of vomitings, and with the narrated history I found that irregular times of foods and his irritable mentality, and all that irregular times of food and all that, I came to the conclusion of giving him the medicine Naxwamka. Naxwamka 200, one dose was given, and some biochemical medicines were given for the satisfaction of the patient. And later, within 2 or 3 days, the pain is gradually increasing, and the father used to bring him and used to keep this boy with me only from morning 8 a.m. to 2 p.m. and later from 4 p.m. to 10 p.m. in my clinic only on the outside bench as like a semi-inpatient. And I used to give him the medicines belladonna or colocynth or magfos in graduated doses and all that to bring that pain to normalcy. And the pain used to be much, and it is relieved in 2 days, and he was sent to his house. And later, after about 1 week or so, the patient started vomiting blood in the night, and the father waited for another 2 or 3 vomitings, and the patient went into a deep stupor, and father asked me to come to his house at the dead of the night at about 2 o'clock. I went there with the medicines chest and all that, and the patient is not in a conscious state, as he has already vomited blood already 3 or 4 times by that time, and he saw for the pupillary reflex, it is not there, it pinpointed pupil, and he is in a deep stupor. Already 1 or 2 vomitings, 4 vomitings were blood vomitings have happened, and the stertorous breathing with snoring is also there, which has led me to prescribe opium 200. Opium 200, 4 or 5 pills were put in his tongue, and later I mixed it in half glass of lukewarm water and stirred it thoroughly, and once in 15 minutes the one spoon was given. Like that 1.5 hours or so has passed, and the patient came into consciousness, and the vomitings also stopped. There are no further vomitings, and the snoring is also gradually stopped, and the patient woke up about 4 o'clock or so and asked why Dr. Saab came to our house at this dead of the night. I told him I am returning from a second show cinema, that's why I stopped at your house and I am going now, like that I told. And later, after a day or two, the patient was brought to my clinic once again, and fresh case taking was once again taken, and it led to me to prescribe lycopodium according to the available symptoms. Lycopodium in 0 by 5 in LM potency was given, and 3 pellets in 1 gram of distilled water. At that time I used to give like that only, and mixing 2 or 3 drops of rectified alcohol, and stirring thoroughly, and daily 3 doses. That means every time 2 drops have to be taken from it and mixed in 2 spoons of water, and like that 3 times a day it was given like that. Like that it went on for about 2 months, and he thoroughly recovered, and there are no further blood vomitings or not even vomiting also, and the pain is also not recurring. And I suggested him to have the food at regular timings in bland diet and in a disciplined way, and he continued like that. I also gained weight, and after 2 or 3 months of treatment, he has completely come to normal, and he did not continue the medication also. Of course, on and off he used to come from some petty issues on and off at the later time. But this type of severe gastric pain or hematemesis or blood vomitings have not appeared, and the patient has come to normal, and he has gained weight. Like that, we can prescribe the homeopathic medicines in the severe cases also. Whenever there is a comatose condition or blood vomitings or gastric ulcer, we can avoid surgery also, provided the patients also cooperate with us in the time. But in the severe cases, when the patient is not responding to this opium or lycopodium or anything, then the surgery has to be taken place. Likewise, first homeopathic usage is suggested, and later, if necessary, only surgery can be taken. With these few words, I would like to conclude at this time. Please, as usual, I request you to please like, share, subscribe and comment on these contents. Thank you very much.